Together we achieve victory over heart failure.
Hello, today I shall be talking about heart failure. Myself is Dr. Prabeen Kumar Rath, Professor of Cardiology, formerly HOD MKCG Medical College, Berhampur. You see, the heart failure is the commonest condition for which the patients often get admitted, and there are many causes which were responsible for the heart failure. The commonest being in our country is the hypertension, diabetes, coronary artery disease, and most important is the idiopathic variety, and the next important is the peripartum cardiomyopathy. Now, the patient should be aware of the heart failure symptoms. The commonest symptoms of heart failure are breathlessness, short of breath, not able to lie flat in the bed. In the night, they will have a nocturnal cough and they get up on the bed. Then swelling of the legs, indigestion, vomiting, and the orthopnea and PND. These are the common symptoms when the patient experiences should consult a doctor. Now, the investigations for confirmation of the heart failure basically includes an electrocardiogram, chest X-ray, and the most important is an echocardiography. Echocardiography, the marker which is defines the heart failure into different categories is the ejection fraction. Ejection fraction normally 50 to 70%. Now, when the ejection fraction is less than 40%, it is the heart failure with a reduced ejection fraction. When the patient has got heart failure, either the symptoms or the signs, but the ejection fraction is more than 40%, then it is the heart failure with the preserved ejection fraction. And then heart failure with a mildly reduced ejection fraction. These are the categories. And the most common symptom of heart failure is the breathlessness, effort, and PND orthopnea. The management of the heart failure is the primary importance of the medical management, where the lifestyle management is very important. Quitting the smoking, alcohol, sodium restriction of the physical activity. These are the important things. But once the patient improves from the heart failure congestive symptoms, the patient should go for a graded exercise. Again, which will increase the longevity. The medical treatment, which definitely improve the symptoms and the longevity, consists of the four pillars. Initially, they said it consists of ARNI, angiotensin receptor neprilysin inhibition, mineralocorticoid receptor antagonist, diuretic, beta blocker. The fifth one, which is now considered as more important, is the SGLT2 inhibitor, either the dapagliflozin or empagliflozin. Now, with these medical treatments, and all the treatments should be started simultaneously, can be started simultaneously, and with a careful monitoring of the sodium, potassium, and the blood pressure monitoring. And the ultimate, all agents should be given within 3 to 4 weeks of the treatment. Once the patient becomes symptom-free, the hypervolemia becomes less, the diuretic can be reduced, but all these medical management should be continued with a proper follow-up. The medical industry also has other options like putting an implantable cardioverter defibrillator, biventricular pacing. And if the patient is refractory and goes into the end stage of the heart failure, then the cardiac transplant is the one. In between, also the patient can be subjected for a mitral valve repair or a tricuspid repair. So most important is that the adherence of the therapy for the patient is very important. And even if the patient improves from the heart failure, they should continue the medical treatment as per the medical advice. Thank you very much.